I don't know who ever made up this myth, but this guy had one thing right, which is this 10% number, because for the majority of our daily actions, we use only 10% of our brains, although we use 100% on a daily basis. So why does the brain use only 10% for some actions? It's like this because these actions are habits, they are routines, rituals, the things that we do every day, like buying coffee when we go to work or paying for our public transportation. You don't really think about them when you do them because you know that you need to pay for your public transportation in order to take it. So once you learn them, it becomes a habit and it doesn't require any thought process or decision-making process anymore. But how does the brain decide if this is an action that only requires 10% or not? It uses the gap, the outcome, and the power as decision-making criteria for itself. Let's imagine that you are sitting in a room, in a couch, and reading the last book of Martin Fowler, and then you feel a little bit cold, and you realize that the window is open. So what happens after this is probably 5 minutes later, you realize that the window is not open anymore, but you have no recollection whatsoever of closing the window yourself. During those 5 minutes, your brain analyzed if there would be any gap, which means any difference between the initial state and the final state of closing the window. And it decides, of course, there is a difference between those two. If you close the window, there will be no breeze in the room. The second thing it does is to analyze if there's an outcome of closing the window, which is there a benefit for me of closing the window? It says, yes, this criterion is met as well, because if I close the window, I won't be cold anymore because it will stop the breeze. And the last thing it does is to analyze if the power criterion is met too, which are the resources. Do you have the limbs to take you to the window, or also the limbs to close the window? Do you have the energy and the healthy state to go there and to do this? When all these are met, you just do this automatically without any thought process or decision-making process. Your brain makes you stand up, go to the window, close it, get back to the couch, keep reading Martin's book. And why did I talk about this? As designers, sometimes we miss that we need to design for this 10% because you cannot design something that is too complex to use all the time. Of course, it will require some learning process when it is first used, but at some point, in order to create new usage habits, you need to use existing habits to create a product. So it will be a lot easier to use, and you can design something that is really appealing to the eye, but unless you make it very simple to use with this 10%, it's not going to be used in the long term. And another thing is, since I said experience design is really important for those systems too, this 10% makes sense in those systems as well, because if you think of the insurance system, it's too complicated to understand that we don't even know most of the time what's in our coverage and what's in our plan. The same goes again for the healthcare system. When you think about the curriculums, they are too complex to understand. The school environment, it's too hostile. So I have identified a few problems, first within the education system, which are the atmosphere environment, the curriculum, teaching methods, learning styles, and the one-size-fits-all approach. The problems with the atmosphere and environment is that we create this environment for kids that are too cold, that are not child-friendly, that are not fun enough or friendly enough, and then we expect them to enjoy going to school and be motivated somehow and for some reason. For me, this is the definition of madness, because no one would like to go to school. I didn't like it personally. And another thing is the curriculums. Like I said, they are too complex, and the things that we are being taught at school most of the time are extremely useless, and even until the next exam, we cannot remember what we have been taught. So another problem with this is we are assuming that every kid is the same, and that's how we are designing the curriculums. We miss that some kids they don't learn as easily as others because they have learning disabilities. Some are from disadvantaged backgrounds, like economically disadvantaged, for example, and some are non-native speakers. So if we assume that everyone is the same in a classroom, we are actually missing some of those kids that can become brilliant adults in the future. Another thing here is the teaching methods. According to research, most people learn when they repeat what's being taught, but in the classroom, the teachers are the ones who make most of the talking, majority of the time that is spent together. So this is another opportunity missed, because if the kids cannot rephrase what's being talked about, if they cannot ask questions, if they cannot talk about the subject, they don't learn. And that also makes for the learning styles. In addition to that, you can add drawing. I used to draw a lot at school. I'm a designer, you know. So I'm a visual learner. I also used to write small stories next to the things that I used to draw. So that's how I learned. I had to see what was being taught to me in order to understand it, to know it, and to store the information for a longer time instead of memorizing. Honestly, the only good outcome for me from the education system was that since I hated memorizing things, I still hate memorizing. It started my career as a designer at a very early age, because before every single exam, I had to find a very innovative way to hide my cheat sheets without getting caught. And all my friends relied on me in that subject as well, so I was pretty popular. The last problem is the one size fits all. As I mentioned, everyone is different. You need to monitor every kid differently, not in a general way, but in the existing system, it's so general, it's so distant that teachers cannot really understand that a classroom is an organism that is made of different individuals and everyone has different needs. So what can be done here? We need to design the education system in a way that it's more engaging, more fun, more interactive, so that we can understand, we can get feedback from the kids and understand if they really understand something or not. And this is really important because an average person spends 14,256 hours in school until they graduate from high school. 14,256 hours. This is a lot of time to spend somewhere that is too pleasant to be in, especially if you hate your classmates, if you hate your teacher, if you don't like school at all. There is nothing productive that comes out of this experience. Another research from American Sociological Association, if I'm not wrong, suggests that a negative classroom experience damages children's mental health. So we are designing curriculums and environments that make our kids sick. So this is not very brilliant, in my opinion. This is a good example of what experience design can do for education system. This is ClassDojo, an online platform and a smart device app for teachers. It's for free for teachers. And it is used in half of schools in United States. And what it does is, in K-12 schools, by the way, what it does is it aims to create a positive classroom community where students can learn how to work together, how to collaborate, how to support each other, how to talk about classroom problems or learning problems where they can thrive and have better performance in school. Also, teachers use it as a rewarding system to create motivation in the classroom, and they can share classroom moments with parents so that parents can track their kids' improvement and the standard of education in the classroom. Another example that I really like are the massive online open courses. They are really important because since everybody has a different learning style, you can take these courses on your own pace and you can choose what you want to learn, and you can study that anywhere, anytime, the way you want. Design in Education is an initiative of the Baltimore City, and what they wanted to do with this project is they want to teach especially the youth about the environment they live in, the politics, the economics, the environment, and everything else that makes this city and that community. And they want their young people to grow up and be productive, efficient, and good citizens, hopefully. And the Baltimore Cares is a sub-project of this thing, and they are turning empty lots into gardens where they grow vegetables and fruits. They teach kids how to do those. They make them build new skills. It's Debatable is another sub-project of it. They are teaching teachers to teach their clients about how to debate, how to have constructive arguments, constructive conversations. They also train the teachers of the K-12 system so that they can teach their students in a more coaching way as well, instead of the traditional teaching style. And when it comes to what experience design can do for healthcare, IDEO, I don't know how many of you know about IDEO, but in my opinion, it's the best design company in the world. And their P3 efforts really align with ours as well. Especially the Open IDEO platform is great if you are interested in those P3 projects. This is a great example where IDEO used design thinking and experience design. And actually, IDEO is the company, and Tim Brown is the guy, their CEO, who introduced design thinking into business. He showed how to combine design and business and make it profitable while caring about people and doing human-centered design. The challenge here was that the hospital management realized that they had such an unpleasant environment for kids. This is a children's hospital, and most of the patients are cancer patients. And what you need in order to fight cancer, the first thing is motivation. But the hospital environment was so cold, and it was, of course, only related to death and sickness. It was really difficult for the kids and their families to find any motivation in order to fight this disease, so that they decided to find a solution for this. That's where IDEO came on the scene, and they worked together between 2005 and 2008. And they didn't only redesign the interior of the hospital, but they also redesigned every single product, service, and system that was included of this treatment. In order to do this, they first did this research with kids and their parents about how their experience, the patient experience was. And what they have learned from the patients was a patient spends most of their time, about 75% of it, looking at the ceiling. So if that's most of the thing that you are doing on a day, you can actually assume that you want to see something good on the ceiling, hopefully. But of course, there's no such thing in hospitals. So IDEO changed this. They created an interactive ceiling where the patients could customize the ceiling and make it more fun, more user-friendly, which is more children-friendly. And they created a very sweet and hopeful environment that they could create in a hospital in such condition. And also the results were great. Of course, no one wants their kids to have cancer, but when this happened, this was the most preferred hospital for this case. A few weeks ago, I had a conversation with a friend of mine. He's trying to build service robots, and when we were brainstorming, I was trying to help him. Don't tell Roy, I don't want to be fired. I suggested that he should sell his robots to healthcare system, to hospitals. And we were trying to find ideas how to promote this product and how to really shape the experience design so that it could be sold to hospitals. The thing that came to our minds is that we spend most of our times when we were in a hospital or in a doctor's room, we just wait for the doctor to be available. If you spend like an hour in a hospital, about 45 minutes you just wait, and for 15 minutes you see your doctor. And when you go into the room of your doctor, what you do is talking about your symptoms. So if we all wait in a waiting room, and if we all talk about our symptoms, so why don't we combine those two? We can talk about our symptoms while we wait for the doctor to be available by using robotics and artificial intelligence. And this product can just come to us. It can be a part of the medical staff. and it can take our medical information from when our symptoms started to our medical history to our lifestyle, our habits, if we smoke, if we drink, our diets, and everything else. So here is a project of ThoughtWorks. I'm actually going to talk about two different projects under this. I don't know if they supported each other or if they were done parallelly. I have no idea. But in 2014, ThoughtWorks was in Kerry Town in West Africa, and they were fighting to stop Ebola. So was Google. And Google was trying to create a tablet that can be dipped into chlorine to be sanitized and disinfected, because you cannot take paper and pencil when you need to take medical records when there is an Ebola epidemic. And what ThoughtWorks did was they created a module for the already existing OpenMRS platform, and I couldn't find any evidence supporting this idea, but I felt like these things kind of work together, because what I learned from the ThoughtWorks website was that they use this software on a tablet as well. So, I don't know. I'm going to talk about two brilliant guys, which are Albert Bandura and Doug Dietz. Albert Bandura is a psychologist, and he generally treats phobias. That's his expertise. And during his professional life, he observed his patients and collected a lot of insights. And based on those, he used design thinking and created this experience, which is a treatment for his patients, and it is made of various steps. What he does is he takes the patient and puts them in a room, and there is another room where is the subject of their fear is, and the person starts by observing the subject of the fear. And when the whole experience ends, the subject of the fear and the person are in the same room. Maybe you can even touch it without being scared. My second example, like I said, is Doug Dietz. He is an industrial designer, and he works at General Electric. He designed an MRI machine, and then he went to a hospital to see how his patients were doing. And he observed only 3 patients interacting with his machine. And he was extremely satisfied with his work. He was extremely proud, until he saw a family walking down the hall, and they had a little girl with them, and she was crying. And the father was saying, "Do you remember what we talked about? You can be brave. You don't need to cry." And Doug Dietz wanted to see what was going to happen when the kid went into the machine. And by the time she reached the door and saw the machine, she just went crazy and started screaming, and her parents were completely lost about what to do and how to calm down their kid, and they didn't have a word to say to console her. Doug Dietz was extremely unsatisfied with his work at that point. Like in 5 minutes, the entire idea about his own work changed just based on the experience of this girl. He wanted to change the experience he created, so he started doing research. The first finding of his research was so disappointing for him that he couldn't believe. What he heard from the hospital management was 90% of the kids who went into the machine had to be sedated, while this process doesn't require any sedation at all. So he created this monster that scares and terrifies kids. And he started talking to children and their parents in order to find out what needed to be done to create a nicer environment for kids. Again, he collected insights, ideas. And what he did afterwards is he realized he wasn't only designing a machine, he was designing an ecosystem, and that machine existed in this ecosystem. If you are designing an MRI room, you cannot assume that only the machine would be the essential part of this design. Because even the signs that show the MRI room, the danger, don't go in if you are pregnant or similar stuff, even those are scary, especially for a kid. So what he did is he created 5 different stories. I'm gonna give one of them as an example. This is a pirate story, and he turned the room into a pirate island. The medical staff were dressed as pirates and sailors. Some of them were nice, good pirates. Some of them were evil pirates. The MRI bed was turned into a pirate ship. And the kid was supposed to go into the bed, the ship, and stand still there so the bad pirates wouldn't catch him. He painted the ceilings, the floor, like sand ocean and everything. So he wanted to see the results, and the usability testing was a test in a hospital in Philadelphia, and the results were amazing. He was extremely happy because he heard a girl asking her mom if they could come the next day again, bringing friends because it was so cool. Another example is another kid asked his father if they could buy one of those machines because it was a great toy. So the results were really great, and the number of the kids that needed to be sedated dropped drastically from 90% to 10%, and everyone was happy. There's a really important thing that we need to understand as designers is if we are designing for the healthcare, the error prevention and recovery from error gets even more important because the results might be deadly otherwise. Because we are designing products, or for the medical team I'm talking about right now, they are designing diets, new treatments that are extremely difficult to follow. And then what happens is if you fail to follow this treatment or the diet or whatever it is, it generally ends with shaming and blaming. Like, how couldn't you do this? You are sick, you need to follow this. Because it's too difficult, because I was eating a tiramisu a day before that, and now I cannot eat a tiramisu for 2 months. Maybe that's the reason, because I'm changing something great in my life, and it is so difficult to do. We can actually realize that the experience of the healthcare system is no different than the experience that a website offers. It needs to be so easy to use and so easy to understand and so easy to remember that you can actually stick with it and use it and don't get frustrated while being a part of it. In conclusion, and I really forgot what I was going to say here. As designers, we have a lot of opportunities to make a change in the world. Today, in the OSCE speech, I heard something like, "We are not saving the world." To me, this is bullshit. We are saving the world. We are saving lives. It just depends on how you take your job seriously or not, but in my opinion, if you are not taking it very seriously, maybe you shouldn't be doing it. And finally, we really need to understand is that whatever you are designing, you need to know that the one-size-fits-all approach doesn't work at all, because that one size doesn't fit most people. Thank you.